Now, for the latest update on how the line for the jab, the queue is doing, progressing, let's go live to Heidi Giokos. She's at Milpark Hospital in Johannesburg, one of the official vaccination sites. Heidi, good afternoon. There's a lot of confusion. I just need to put this out. I mean, I know of somebody who's not 60 yet, and 2 days ago they got their COVID-19 vaccine. There's been a lot of confusion, and now there's an expanded definition of healthcare workers who may or may not get the jab. We were expecting those above the age of 60 to get their jab from next week.
Yes, certainly, Badan. I do think there was some confusion. There is still some confusion with regards to who can get the vaccine under the Sisonke trial. One must remember that the J&J vaccines that were brought into the country were under those 500,000 doses, I must be specific, were under the Sisonke trial, specifically targeting healthcare workers and support staff. But ENCA saw a number of other people in queues at Charlotte Maxeke on Tuesday, raising questions as to who's actually getting the jab. And this morning when we got there, we did see a very long queue with people complaining and indicating that they have not received the jab yet. But we have since moved on to Milpark Vaccination Centre, where it's quite the same picture, a very, very long queue, possibly thousands of people here. But we are joined by the vaccination site manager. Richard, thanks so much for your time. We do appreciate it. You have a lot on your hands right now. There are thousands of people here. How is this vaccination site dealing with the influx of people, and why do you think so many people have come at the last minute to get the jab?
Thank you very much, Heidi. Thanks for the opportunity and welcome to our site. I think first to answer your last question, everyone is desperate for the vaccine. Everyone's keen on the vaccine, and we fully understand the people's desire to be vaccinated. We certainly appreciate that. We also appreciate our role that we have to play in society in terms of vaccinating as many people as possible. To your point about who should be vaccinated, who shouldn't be vaccinated, we obviously are in a phase of the process with the Johnson & Johnson Sisonke trial, but we are still vaccinating healthcare workers predominantly. Now, I won't stand here and say to you that one or two people haven't slipped through the cracks, but we do an extensive check on the persons coming through to ensure that they have both registration with their relevant healthcare professionals body, as well as the voucher code issued in order to ensure that they get the vaccine and are eligible for the vaccine. So what you see going on behind me here are a number of screening desks to assess the persons, to check and make sure that they have those credentials prior to us actually allowing them up into the vaccination site themselves.
What happens if somebody does not have a voucher or is not a healthcare worker or support staff and they take their chances because they also want the jab? How do you handle that situation?
I think it's very important we handle it with the utmost degree of tact. As I say, the people really are keen on the vaccine and desperate for the vaccine in many cases. So we have a very lengthy discussion. We do explain that for us to give a vaccine to someone who's not a healthcare worker at this point in time does mean taking a vaccine from a healthcare worker. And really morally and ethically we do ask everyone to search within themselves to find out what they believe is right and wrong. Again, if they really are found to not be healthcare workers and not be eligible, we do explain to them that there are further rollouts at a later stage, which will be communicated to them by the relevant authorities in due course.
And just speak to us about the kinds of numbers you are seeing, specifically from Tuesday, with a lot of panic that Sisonke is ending tomorrow. What have you been seeing over the past couple of days?
So we obviously are provided with a finite number of vaccines per site. Our target for the site is around 2,500 vaccines, slightly more. Yesterday we were able to secure an additional number of vaccines, and we ended just shy of 3,000 vaccinations for this site. So those are the sort of numbers we're dealing with. Unfortunately, we do need to turn a few people away, regrettably. We would like to vaccinate everyone, but obviously there are only so many hours in the day, and we're really around the 3,000 mark is where we are on most of our days, especially since Tuesday.
Are you able to secure more vaccines to deal with the influx of people and the capacity that we are seeing here?
So we are in daily or hourly communication, constant communication with the Sisonke and the trial team. We obviously are trying wherever possible to see what is available in order to properly utilize the vaccine. The last thing we want, and something we're very proud of, is that we haven't seen a single vaccine go to waste at the site. And so we do work very hard in conjunction with the relevant structures to ensure that we vaccinate as many healthcare workers as possible and really use as many of those vaccines as are available.
Okay, great. Thanks so much for your time, Richard. And good luck. It seems like it's quite crazy at the back. back. So I think, Bradan, just some sense of how another vaccination centre is faring. Earlier on, we also saw long queues, and here we see exactly the same. I wish I could take you down, but it is 7 floors down where the queue actually starts from. Driving in, there were cars literally everywhere on the island, all the way down the traffic circle, if you do know where Milpark is. So it's extremely packed here at this vaccination centre. But as you heard the vaccination site manager saying, that they are trying to deal with it as adequately as possible, and those who are not supposed to get the vaccine are turned away. But it's also on an individual to be honest and truthful about whether or not they are healthcare workers or support staff.
Okay, sorry, but I thought you were Charlotte Makleke earlier when we crossed to you. Now, Milpark is one of those centres. Thank you very much, Heidi Giokos.